Now today is our third lecture in the series of lectures in which we see how to make a diagnosis clinically. In first lecture we discussed the presenting complaints, and in the second lecture we discussed the details of presenting complaint, that is the history of the presenting complaints or the history of present illness. Generally these two important parts of the history lead towards a diagnosis, and if you are good and experienced, generally you make a diagnosis in these two parts of the history taking process. But if you're not able to make a diagnosis, we can have additional clues on the history of the patients. So what are these additional clues acquired from? When you start taking interview, you can have these additional leads from the past medical illness, from any allergies if the patient has, what type of lifestyle, the addictions, the family history, the socioeconomic history, the obstetrics and gynecology history in case of females, and then systemic review in which we systematically see all organ systems and evaluate them for the presence of any clues that can lead us to diagnosis. Now we see these portions of the history taking one by one and see what we see in these portions. Now, past medical illness. Past medical illness is very important. We discussed in the last lecture that majority of the presentations may be because of a continuing past medical illness or a complication of past medical illness, or an illness which is new but it's on top of an illness already going on. So past medical illness is very important. So record any past medical illness that this is continuing and the patient is on treatment. If the patient is on treatment, what sort of treatment patient has been taking? It is surgical, or the patient been on drugs, and what drugs the patient has been on. Then if this is a healed past infection, then record of the infection, what was the diagnosis and what treatment patient was offered, and have information about all past medical illnesses. Sometimes patients do not think that few illnesses, they are not important, they do not mention. So try to get hold of all information about the patient's past medical illness. Then also go for the evaluation of hospitalization. Has the patient ever been hospitalized? If the patient was hospitalized, for what reason he was hospitalized, and what was the hospital stay, what were the exact procedures done, was he given a diagnosis, and was he discharged on a follow-up treatment. And then also evaluate about the presence of any surgical history. And then another important thing, transfusions. That is quite a few problems may be because of transfusion related complications. So have all these portions of the history taken in the past medical illnesses. And then look for the allergies. Does the patient have any allergy which can be explained by the patient's living place or patient's workplace? Some of the drugs, they cause allergies. The patient may present because of the allergies of those drugs, and if there are known allergies, you have to avoid those drugs in your prescription as well. So one should be very clearly aware of what sort of allergies patient has. And then food allergies or miscellaneous allergies. For example, some of the patient may have allergies simply with hair dye, or they may be contact dermatitis for any other reason. So go for any allergy if it is there. And then look for the habits and lifestyle. It is very important, because lifestyle can result in many illnesses. For example, patients who got no physical activity and have sedentary lifestyle, they are predisposed to certain type of diseases. And patients who are active and very athletic, or patients are very mobile, they tend to have more of joint type of injuries. So look for the presence of the lifestyle. Is active, mobile patient, or it's sedentary, bedridden. Then this is very important, the assessment of the job. Not only the current job, all jobs patient has been going through in the past should be evaluated, and the exact nature of patient's involvement in the job should be seen, because it's not simply that he was a laborer. the exact details of the patient's labor should be known, and you try to find out what sort of exposures the patient had in those labor jobs. So details of all jobs should be taken, and if possible all sort of exposures during that job should be assessed. And then look for the presence of addictions. Smoking is very common, and should see how long has the patient been smoking and what has been the daily smoking frequency, so that you can categorize the patient using the packed year method. That is, if a patient takes 20 cigarettes a day for 1 year, this is 1 pack year. So you use this parameter to assess what would be the possible risk of this cigarette smoking to the patient. And then similarly you assess the risk of alcohol by checking what is the amount and what type of the alcohol and what duration the patient has been taking alcohol. And then betel chewing in certain areas can result in the carcinomas in the oral cavity. They should be known. And then recreational drugs, whether they have been oral, the patient had been sniffing, or it was injectable drugs the patient had been using. So go for all these details, and then take the family history. Family history is important because many diseases, they continue in the family. So take a detailed family history. Look what first the parents, they are alive or they are expired. If they are alive, they are healthy or they are carrying some disease. And if they are carrying a disease, what is the disease they are carrying? And then if they are expired, did they have any disease, and what was the possible cause of death if it is known. So try to go for all these features in family history. Similar history should be taken for the siblings, the children, and in the first degree relatives as well. So details of this history should be seen in all family members, because as I mentioned, autosomal dominant diseases may be apparent in the family, but the autosomal recessive diseases or the X-linked recessive diseases or polygenetic diseases may be present in other members of the close family group. So try to have information about it as much as possible, and if required, ask the patient to bring any records if they are available. And then socioeconomic history. Socioeconomic history is important because certain diseases, they are more common in certain social groups or economic groups. And similarly, when you are planning treatment, you have to keep in mind that you should know patient's economic status and the social cultures of the patient, so that you are able to convince the patient for that treatment, or you have to check the affordability of the treatment, how the treatment can be planned for a particular group of patients who cannot afford the treatment. So you have a socioeconomic history should be taken in detail. What is the social class of the patient? Is there any family support system available, particularly in case of children and older patients? And then patient is covered by a non-governmental organization, or patient has a governmental support system. In certain areas, in certain countries, government support system is available, but in many developing or underdeveloped countries, we do not have these government support systems which are very well established. And then if the patient is health insured, patient has got health insurance or no health insurance, that will be helpful in deciding to investigate and treat the patient. And then obstetric history and gynecological history in case of females. You see, you look for what is the age of menarche, what are the monthly cycles, they are regular, they are irregular, the bleeding pattern, is it regular bleeding, or patient has the amount varying during the cycles, what is the age of menopause, how many patients had pregnancies, how many were successful, were there abortions for medical reason or for some other reason, that all should be documented. Similarly, the gestational age at the time of the abortion should be recorded. And then, were there any issues in the labor, was a surgery required, or what happened in the third stage of the labor, particularly if the patient had increased bleeding and required blood transfusions. That may also helpful in finding out if the patient develop complications because of the third stage of the labor. So all these details should be recorded. Then finally, we go for a systemic review. In systemic review, we check all the organ system one by one. We go for the complaints of nervous system, like you question patients about the symptoms in the nervous system, that is any headaches or any symptoms in the territory of cranial nerves or the long tracts. So sometimes you have to put in leading question these patients to evaluate about the systemic review in various organ systems. Check for the cardiovascular system, the respiratory system, the ear, nose and throat system, the GI and liver, the genitourinary, the musculoskeletal system, and look for the presence of constitutional symptoms. Constitutional symptoms mean the patient had fever, does the patient have weight loss or similar symptoms. So go for the constitutional symptoms analysis as well. So these are all different type of reviews which you finally take and get clues from these, which may sometimes directly aid you in making a diagnosis. So these are, although we think that this may be lesser part of the history taking, but you see in quite a few patients, these components of the history may give us a direct clue towards what is the diagnosis. So their importance cannot be undermined. Although the presenting complaints and the history of presenting complaint is the most important, but these may also be very, very helpful in some patients where you are unable to make a diagnosis on history. And if you evaluate the history thoroughly, you see in 70 to 80% of the patients you reach a diagnosis. And in the next lecture we are going to discuss few complaints, that how we assess those complaints. For example, if the patient presents with pain, how we assess pain, or if the presentation is shortness of breath, how we assess the shortness of breath. So this will help you in designing in your mind how to proceed when patient presents with a particular symptoms. Till then, goodbye.